Some common insects that can cause trouble are mosquitoes, bees, wasps, fire ants, deer flies, to include others. They're often annoying or painful, but only occasionally do they significantly cause concerns. Mosquito bites usually cause itching and redness and swelling, but still, they're not just pesky. According to the World Health Organizations, they're responsible for well over 400,000 deaths worldwide annually due to being vectors that spread disease. Since mosquitoes occasionally pose serious health risks, we want to take precautions to reduce the chance of getting bit. So wearing long sleeves and pants, or using insect repellent containing DEET or picaridin, and avoid being outside during peak mosquito activity like dawn and dusk can all help minimize the chance of getting bit. If you do get bit, wash that bite area with soap and water to prevent infection. If needed, you can apply a cold pack or cloth soaked in cold water to reduce itching and swelling. Over-the-counter topical ointments such as hydrocortisone cream might also be appropriate to help with itchiness. Avoid scratching the bite since this can cause further irritation and increase the risk of infection. Now, let's talk about bee and wasp stings. While most people only experience pain and mild reactions, some may be allergic to bees or wasps and require immediate medical attention. To avoid being stung, wear shoes outdoors to prevent stepping on a bee or wasp and avoid high-risk areas. If you come in contact with one, stay calm and avoid swatting at bees and wasps, as it can provoke them to sting. For most treatments, first check to see if there is a stinger. If a stinger is present, carefully remove it by scraping it away with a credit card or a fingernail. Do not use tweezers or squeeze the stinger. Then, wash the area with soap and water and apply a cold pack to reduce pain and swelling. Now, if there are signs of an allergic reaction, such as difficulty breathing or swelling of the face or throat, call emergency services immediately. If the victim is prescribed an EpiPen or an auto-injector, use it as prescribed and keep the patient calm. Fire ants can be aggressive and deliver painful stings, especially when disturbed. Be cautious around mounds and disturbed soil. Wear closed-toe shoes and avoid walking barefoot where fire ants are prevalent. If you do get bit, brush off any ants immediately to prevent multiple bites. Wash the affected area with soap and water, apply a cold compress to reduce pain and swelling, and avoid scratching to prevent further irritation or infection. If the person experiences difficulty breathing or exhibits signs of severe allergic reaction, call for emergency help and use an epinephrine auto-injector if the victim is prescribed. Lastly, let's address deer fly bites. These flies are known for their painful bites but do not carry diseases. To help prevent bites, use insect repellent with DEET or picaridin and wear light-colored clothing as they are less attractive to deer flies. If you do get bit, wash the bite area with soap and water to prevent infection and apply a cold pack or a cloth soaked in cold water to reduce pain and swelling. And an over-the-counter pain relief cream may help alleviate discomfort. Avoid scratching the bite to prevent further irritation and infection. Remember, preventative measures are essential to reduce the risk of getting bitten or stung. These first aid steps can provide initial relief, but seeking professional medical care for severe bites, stings, or allergic reactions is essential. Monitoring for allergic reactions might also save someone's life, so watch for signs or symptoms such as difficulty breathing, swelling, or a rash spreading beyond the bite site. If severe allergic symptoms occur, call emergency services immediately and use an epinephrine auto-injector if the victim has one prescribed to them.